Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
6 months, it'll be 5 years.
Wow.
In 6 months, it'll be 5 years.
Oh, wonderful.
Yeah.
Wonderful story.
Yeah, thanks. And I've known JB for a long time also.
It's 9 o'clock, so I guess we can get started. I have a couple of articles from the Monday's Washington Post that I thought to share. Of course, one of the first ones is the one that talks about measles being the canary in the coal mine, and that as we see these cases of measles cropping up, that it's a fearful sign that we are not doing what we're supposed to be doing, and that measles is the most contagious disease known, and we had just about eliminated measles from the country and almost the world, and now as a consequence of not being vaccinated, we now have almost 1,000 cases of measles in the United States. And we know that with 2 doses of the measles vaccine, you can eliminate measles completely. And so the fact that we're having these new cases is a sign that we are not being vaccinated enough. And the real concern is not only about measles, but that measles is just the tip of the iceberg. And that the first sign of the fact that we no longer have the herd immunity, which is so desirable, is that you start having cases of measles first. And we know that if you had 2 doses of the measles vaccine, that's a lifetime prevention for measles. But then once you lose that herd immunity, then other diseases, other contagious diseases start coming in. Next is pertussis, or whooping cough, which is likely to occur after we no longer have the herd immunity. Then the meningitis, then polio, rotavirus, RSV, and then, of course, tetanus. When I was in Africa, the commonest disease actually in the hospital was tetanus, which is, of course, completely preventable. And then there's hepatitis B and diphtheria. All of these conditions that are likely to follow if we lose our herd immunity to measles, and the other diseases then follow thereafter. So that the vaccination issue is a very potent issue that needs to be addressed very seriously, because the consequences are very negative for all of us. And so we have to take very seriously what this new administration is doing with vaccination, and it's food for thought. Any comments before we go on to the next topic?
It's just totally preventable, and it's almost like telling lies to people who don't understand and think they don't need it. If you ever have to take care of a child with measles, I had measles when I was a kid before the vaccine was available. I'm telling my age now here, but it wasn't. My mother our house had burned down. We were living with my aunt in her garage apartment, 3 kids, and 2 of us had measles at the time. It was horrible.
Oh, wow.
So it was a disaster. But now it's we've come so far, we've prevented a lot of these diseases from happening by a simple vaccination. And there is no proof, there's no concrete proof that any of these vaccinations cause autism. And that's the big worry. And it's just ridiculous. Until you show the data and show that there's absolute correlation, it's just ridiculous.
Any other comments?
Sorry, Dr. Callender, that just makes me so angry I could scream.
Oh, that's what the group is for, to hear opinions like yours.
Yeah, the whole COVID thing kind of threw vaccinations into the spotlight, and it just caused so much. It's caused a lot of doubt as to vaccinations, and many times probably falsely. But it just kind of it got thrown out there, and now I think probably statistics about people taking their certain vaccinations has been lowered because they just don't trust the medical advice about it. I mean, that's my only comment. It seems like I'm sure it's been there's been doubters through the years, but that COVID was like a paramount occasion where where people start doubting vaccination. So that's the whole. And now you got Robert Kennedy, kind of integrative medicine, maybe further confusing the issue. So that's my thought.
Thank you for sharing. Anybody else
Sure.
want to share anything?
I have one as well with the uh, with one of our first articles. I just want to share is also about the vaccination acceptance in the United States. So we're going to talk about that again very shortly.
Okay.
And Dr. Callender, I didn't hear about chickenpox. Is that one of them?
Well, actually, measles, mumps, and but
Rubella.
chickenpox is not one of those that crops up because I think chickenpox is one of the things that is vaccinated for, and so that is not listed as among the diseases that is likely to occur. We know more about chickenpox because after you reach the age of 60 and above, your ability to knock out the varicella virus decreases, and therefore you get a secondary zoster infection that actually has nothing to do with the fact that you had been previously vaccinated. It's just that your immune system has waned, so that's why chickenpox is not included.
Isn't chickenpox related to shingles?
Yeah, it's the same virus. Yeah. Chickenpox is the zoster virus, and chickenpox, the antibodies in your body until you get up to the 60s are enough to keep you from getting chickenpox or zoster. But then after you reach 60, your immune system wanes and your ability to protect you from the zoster virus is incapacitated. Any other comments or questions about that? Because I thank you very much for your comments and your questions, because that's helps us to keep everybody honest. The second article is an article about how high blood pressure can silently wreak havoc across the entire body. The only problem with this article is that it doesn't address the number one issue with hypertension. And the number one issue with hypertension is that it's a silent killer. And if you do not take your blood pressure, if you don't have a sphygmomanometer at home and you don't take your blood pressure, then you can't know what your blood pressure is, and it can be silently killing you. It talks about the way in which the high blood pressure silently attacks the blood vessels, the arteries first with arteriosclerosis, uh, decreasing the ability of the blood from the heart to get into the organs and tissues. Then it talks about how it affects the heart, and you get heart attacks and congestive heart failure because the blood vessels going to the heart are narrowed. Then the blood vessels to the brain are impacted. You get a stroke, you get all kinds of problems that result in ischemia and poor circulation to the brain. Then it affects the eyes that lead to blindness because the circulation to the retina and the important parts of the eye are obstructed. Then you get erectile dysfunction for men, and perhaps decreased libido in women because you don't have good supply to the sexual organs, and then to the kidneys, which are affected by the arteriosclerosis or the decreased circulation to the kidneys, which then leads to uh, kidney disease. And then, of course, if you have uh, circulatory problems in the legs, you can lose your limbs, you get amputations. And so there's so many negative things that occur as a consequence of having high blood pressure, the silent killer. But the real remedy is not mentioned in this article, which is that all of you should have sphygmomanometers, and you should measure your blood pressure once or twice a day to make sure that your blood pressure is lower than the equal to or lower than 130 over 80. And if it's not, then it needs to be treated so that you have a normal blood pressure. And that is probably one of the biggest problems in the United States. In addition, of course, the importance of diet and exercise are as important as well. But it all begins with you having or not having a sphygmomanometer that allows you to measure your blood pressure once or twice a day and keep a record of it so that you and your doctor can keep you alive.
Yeah.
Any comments about the silent killer?
Yeah, I do. I am right in the midst of, I'm, I've been in, pretty good shape, even with the, taking half my liver. My liver enzymes are in range. I worked a blue collar type job, so I've had a fairly good cardio. I'm a former athlete, but all of a sudden I have come. I wear a Fitbit all the time, and especially blood pressure. While I was before they found the cancer, I was doing things like that. Taking my blood pressure. But now I know it's not a medical device, but I wear a Fitbit and I'm very aware of my resting heartbeat, right? So it's usually like 70, 72, 74. All of a sudden, there's been an increase in that uh, to like in the 80s. And so along with that, I have a I have a aneurysm on my ascending aorta of 4.5, and so that I got to watch. And there's something a very slight aneurysm on my descending aorta. So I can't. I just got to do like I can't go hard on my exercise like at the gym. I just have to steadily exercise and stay active. That's been my thing. So I just had a stress test. I just had an echocardiogram, and I'm waiting for the summary results from my doctor on my chart. But I'm concerned about that because I don't know what precipitated that. I know that like very little exercise. If I'm sitting there and I'm at 83, and I go take out the trash and run around back and come back into the house, not even that much activity, it's up to over 100, my resting heartbeat. So that's just one side of it. And I know in your case, you're talking about, putting a cuff on and getting my heart rate. It really varies. I'm like 130 over 80, or it went sometimes when I go to the doctors, it's higher. I mean, I've had higher readings lately, so I'm attending to trying to figure out what's going on. I take 50 milligrams of metropolol, and that's all. I eat right. I'm on the lower spectrum of diabetes, so I watch everything. I'm a clean vessel, no drugs or alcohol for 36 years. So, I just kind of, I follow my health. My health is important. I'm 72 years old. So some things are popping in, but I'm, you know, that's why I love being here, love hearing that, because I'm right in the midst of it right now. And I'm just waiting to get some guidance from my cardiologist about that.
Thank you for sharing,
Sure.
Darryl.
Elephant in the room. Most of us, are overweight, and that contributes to hypertension. So, got to get the weight down in a healthy range. Although hypertension can affect the skinny as well as the fat. So, it's extremely important, especially when you get in your 70s, to track your hypertension, to measure it, the blood pressure cuff at least twice a day, and to keep a log. What I do with my log is I make just a few notes about, what I did the prior day, because that affects what your reading is today. Like whether or not you got 8 hours sleep, uh, if you did indulge yourself and eat some French fries or whatever. But it puts you more in tune with yourself. And so that you now, with the log, you become familiar with what's driving your hypertension.
Roger.
Thank you. Any other comments? Thank you for
Thank
sharing,
you.
Darryl. The third article is one that's interesting. It talks about the mistakes grandparents make when it comes to putting on babies' car seats. And you know, uh, we as parents and grandparents have gotten to learn to be how to put on the car seats, and I guess many of our grandparents aren't aware of the fact that you have to install it correctly, and they have to have it rear facing first, and then after they get to about 3 or 4, then you can be forward facing, and
Like a relish in this.
following the directions becomes very critical. But that's the third thing. I don't know how many of you grandparents actually are involved with putting uh, your grandchildren's car seats on, but it's something that it was enough for them to have an article about the grandparents properly putting on car seats for little children. Any comments about that?
Dr. Callender, good morning, everyone.
Good morning.
I'm happy that I'm a grandparent, that when my grandkids were little and I really was taking care of them or had them around, car seats weren't in the picture. So I didn't have to deal with it.
Yeah.
So now, by the time they come over, their parents are with them and blah, blah, blah. But when I was involved in it, there were no car seats.
Right.
Okay. Any other comments? If not, um, there's also an article that I thought might be thought to be controversial, and that is they're talking about actually eliminating nighttime and putting things into the sky that won't allow you to have nighttime. What are your thoughts about that? Is that something that we should let happen? Or is that something that
Are you talking
This
about
would
daylight
be-
savings time? Is that what you mean?
No, no,
Oh,
no. Talking about putting into orbit factors that will change the night to day so that
oh
you won't have
wow.
any nighttime.
Well,
Uh,
other than the circadian rhythm issue in your body, that
that's a big issue, though.
right,
Circadian issue is a big issue, of course. Uh,
That is
Darryl, you
absolutely
had a
the
comment?
dumbest.
yeah, right,
Agreed.
My
I mean, and
comment
then
is
there's the,
that is the
go ahead.
dumbest thing I've ever heard. Because
Agreed.
it's not just circadian rhythm.
right,
It's okay, we have a light pollution problem that's related to the subject of what's happening to the honeybees. They're dying off.
right,
Um, Bees, insects, they pollinate our food. A lot of them do not mate when there's light present. In urban areas where we leave the lights on, outside lights all the time, insects are dying off because they can't breed. We need the nighttime. If you look at a satellite picture of the Earth, you look at America at night, it's lit up. You look at Africa, and most of Africa is dark. But that's healthy. That's the way it's supposed to be. We don't need lights at night, especially outside lights. It's indirectly killing our food supply by killing insects.
Agreed. And then there's that other article that shows that you don't get appropriate sleep if you sleep with lights on and things like that. So how contradictory, right?
Yeah, yeah. Well, I just thought I'd share it so you could
Yeah,
give some comments about it because we need to stop it before it gets started. I think
absolutely.
that's important. Right. Okay, well, John, you can start the articles. Yeah, this is an article that was reassuring that most places, most Americans trust vaccines in spite of the recent administration's distrust for vaccines, and that school mandates are thought to be desirable. It's interesting the difference between the Republicans and the Democrats, and that the Democrats strongly supported the vaccines, whereas the Republicans were less supportive, although they were supportive as well. But I think it's so important for us to keep all administrations, whether they're Republicans or Democrats, so that they'll do what is the healthiest for the nation, because that's what matters, not what what kind of politics you believe in, but what is important is what is healthier for America. And so I think we have to be careful and not be relenting in terms of allowing the administration to force us into unhealthy practices. So this is an article that is very timely, and it's nice to see that most Americans have rejected the anti-vaccine mentality. Any comments about this article, which is very timely?
Dr. Callender is, I saw that sentence that we just passed, make America healthy again. Aren't we living longer than we used to? And even though we did eat healthier, isn't the lifespan extending with our fast foods? Not saying that fast foods are good for you, but aren't we living longer than we used to?
Yeah, but we're not even living. We are not the longest living country. We're way down the list, so that yeah, we are living longer, but we need to live even longer and be comparable to the healthier countries in the world. Yes, but to answer your question, yes, our lifespan has increased over the last year.
Why has everybody's lifespan increased? Is it because of medicine, or what are the factors of that's increasing our lifespan?
Well, I think the vaccines are one of the major things that has increased our lifespan. But it's just that comp comparing us to other countries, our lifespan is among the of the countries that are that have long lifespans. We don't compare. We're probably in the second category, and so. But I think vaccines. But I think also the fact that we trying to do away with mRNA is an effort to take us backwards, because mRNA is taking us forwards and making vaccines and other things that prevent diseases to be more effective. And we need to do those things that take us so that our lifespan will continue to increase, so we'll be competitive with other countries that have lifespans that are 2 to 3 years longer than ours. Dr. Perez?
And the fact that, good morning, everybody.
Morning.
The
Morning.
fact that we have gotten to the point that information, what makes this group so important is that information. Some say that if we know better, we do better. But if you are only listening to Republicans, if we are having information specific to a group, we are going so far back. I've heard around COVID, and when my brother transitioned, it was a big fight with my nieces and nephews because I couldn't be with them if they weren't vaccinated. Because and
Really?
And my niece tells me, well, in the Bible it says this and that. I said, how many other scriptures have you heard from the Bible on your social media networks? And that was the only one. So the propaganda, the lies from the very beginning, when you were talking about measles, before we had 5 television stations, and everybody listened to the 5 television stations. It wasn't all right or left, but you got information about everything. Now you can only get, if you wanted to, information about things that you want to hear. You don't get a baseline. You can be totally screwed. You could be totally directed in a direction that is consistent with your politics,
Right.
and not consistent with the knowledge that we know. And that is very, very scary.
Oh, yeah.
Darryl?
Okay, I'm taking a contrarian view on the question of are we living longer? Americans are anywhere in the world, just human beings. You go back to around George Washington's time. There were people living into their 80s, 90s, and 100s. That's where we top out currently now. You go back to Jesus' time. There were people living in their 80s, 90s, 100s. So rather than are we living longer, I like to think that we're not dying quicker, because when you back out infant mortality, infectious disease, and accidental deaths from not wearing seatbelts or so on, then that's the drivers of why you don't live long, why you don't have long average lifespans. They say that people were dying on the average in the 30s in Jesus' time because they had all that infant mortality, infectious diseases, and so on. They were lowering the rates. But you look at the records, and there's still people going back thousands of years ago. They were living. We top out as about 100 as human beings. That's where we have a real struggle getting past that. And what's the downstream effect going to be in 20 years of us consuming all these plastics into our bloodstreams? So we could get a dip. We got a dip in longevity with the pandemic. We could get a major dip with plastics. So I don't know that I'm not really impressed with human beings on the question of are we living longer.
Any other comments?
Yeah, I have
Sharon?
just a small comment. Ms. Perez was what she was talking about. I totally agree that the politics have gotten so entrenched in what you accept and what you don't accept. Like the vaccination question. That's an extreme side of things that causes like a polarization. But then on the other hand, some of the things that are being introduced are like the level of the red dyes and the more information about seed oils. There's a combination of information that should be accepted, but there's such an influence, like Ms. Perez said, and the politics of this thing that somehow that's got to be the conversation. Like, it's like pick and choose. I don't know. It's the exposure, I guess, is the most important. Get all the information out there because it's totally influenced by politics. That's all I can. That's what I have to say about it. I agree.
Any other comments?
I've noticed that my young granddaughters that are in their 30s and 40s don't believe in vaccinations. They don't take the flu shot. They don't want to take COVID vaccinations. They only did it because I said, "Don't come to my house unless you've had it." But I noticed, and one of them told me, well, if when I have children, I'm not going to get them vaccinated. So that influence in social media is really really affecting our younger generations, and it's a scary thing to think that they're going to you know pass that on to their children.
Thank you for sharing. Any other comments? Okay, let's go to the next article then. It's interesting, the more that people talk about why not to be vaccinated, the more information we get on why we should be vaccinated. And this is another example in that the COVID vaccination protects against preeclampsia, which, of course, is one of the uh, complications that occurs when you're pregnant and leads to hypertension and kidney disease and other complications. And here you have another article that demonstrates the benefit of having a COVID vaccination. Once again, uh, making you wonder how people who should know better uh, don't know any better and are talking about not getting vaccinated when in point of fact that's the antithesis of what they should be talking about. But anyway, I think that social media has been one of the most negative things that we've had, and the influence is from outside of this country as well as inside the country. And I think the many people from outside of the country think this is a good way to influence our country, and unfortunately, it is uh, hurting us. Any other comments about uh, this article? Another demonstration that vaccination is good for us. Dr. Perez?
And you use the word influence. And there's so many people who try to be the status of being an influencer. I mean, it's really scary to influence, not a deliverer of knowledge, but someone who is going to influence. I mean, we're going in the wrong direction. There are people who don't know anything about anything. I mean, and because they have followers, they become an influencer.
Totally.
And so they are able to spew lots of misinformation to lots of people. And it's a significant problem. You preeclampsia, when we're talking about Black women and maternal mortality, it's scary.
Yeah, it's what is really scary is the fact that what you've mentioned is that people who are ignorant are becoming the biggest influencers, and they have no knowledge, but they spread their ignorance across the country. And the biggest obstacle we have today is the miseducation and misinformation that occurs as a consequence of social media.
Do you think there should be some like public commercials about, the iron lung and what that all looked like before we had vaccinated? I don't think people nowadays realize, what got us to vaccinations to begin with and the horrible diseases that we have essentially cured with vaccinations. And maybe they don't realize how significant this was. I
Well,
don't
it's
know.
ignorance. It's ignorance. You're right, and so education is the real issue, and since social media thrives on um, ignorance and
Yeah.
misinformation, and it then becomes a major negative influencer, and so therefore we have to have programs like this that help people to understand that information is power and that they need to be educated and not miseducated. Any other comments? John Buchanan?
Yes, I've heard that foreign countries who are trying to uh, destroy democracy, or at least the United States version, are paying people, funding uh, uh, these influencers to put out negative information, bad information. And that's a very good point. Some of them have millions of followers who just who take it in. Sometimes even if you don't act on it, your mindset is different as a result of listening to some of these um, people that come up on Facebook and Instagram and what was the other one? TikTok, that was owned by the Chinese government. And you can find just about anything that you can think of. A lot of it's positive, but a lot of it's ridiculously negative, and can cause, if a bunch of people adopted what they saw on some of these media sources, we would be in serious trouble, very serious trouble. And just one last thing, I'll never forget Ebola. Okay, Ebola. If you got Ebola within 2 hours, you would be dead. So it's easy to track. You just look for the track of dead people. You know, and if we didn't have our technology, that disease could have destroyed nations, not just neighborhoods or cities, nations. Thanks.
Okay, thank you for sharing. Betty Blaylock?
Yes. Someone earlier mentioned that I think it was Dr. Perez who said that we used to just have 2 or 3 news programs, but not only you all are talking about the influences, but now even our regular news programs just infiltrate a lot of
Uh,
stuff that's not news. I mean, it used to be Walter Cronkite came on and gave you the news, but they come on and give you so much other stuff. And there's so many news programs that you don't even have to go to. I don't even look at the TikTok and the this and the that, but you get it from just a regular news program.
Amen.
So I've stopped listening to news really, maybe just once a day or twice a day, because it just becomes ridiculous.
I'd like to add one thing. We're up against AI, and now there's such a flood of AI and so many people who know how to use it. They're creating, information on the internet that you once again you further cannot tell if that's the real person or not the real person. This doctor or that doctor. I mean, there's so much AI out there. That's a new thing that's in the picture too, as far as misinformation. Powerful and very tricky.
Thank you for sharing. Thank you for sharing. Very good point. Any other comments? If not, we'll move on. But all of those points are so critical, and AI can be abused just like anything else, and it can be a factor. And one of the things now is that that's a new way of people cheating is AI, and so its ability to positively influence and negative influence is there, and so it has to be considered, as you have mentioned, as a factor uh, for negative information as well as
Right.
other information.
Hmm.
Okay, this article talks about large vessel occlusion and strokes, and how with this new medication, alteplase, that the ability to get rid of clots without increasing bleeding has now become a reality, which means the management of strokes will be much better because you won't. In the past, one of the problems with the medications that eliminated the clots, they also increased bleeding. And so now with this new medication, the bleeding that used to occur does not occur, which makes the ability to heal people who have strokes much better. And that's very positive. So and it's so important that as we get new information that we share it. And as Dr. Perez has said many times, programs like this that give out accurate information and update on what's going on become more and more critical as time goes on. And as a matter of fact, while we've been doing this now for more than 50 years, it is something that has become more necessary now than ever before because of the decrease in the sharing of information, so that having more proliferation of programs like this and the work that Darryl is doing with his Black Health program becomes very critical. Darryl and then John Buchanan.
Yeah. Do you see any possibility of carrying one of these medications along with you, like an EpiPen, so that if you had a stroke, you could just take it orally?
Well, this is not available orally.
Oh, okay.
It's not available orally, but this is the first one that isn't associated with the bleeding complication. So down the road, it's possible that could occur. But this is a brand new drug that has eliminated the bleeding problem. And so once a diagnosis is made, the elimination of the clot now becomes doable without the bleeding complication, but it's not available orally yet. John Buchanan?
I think you might have just answered my question. A thrombectomy, is that where they remove a clot?
Yes.
Okay.
Yes, they remove the clot The problem was that often the medication that helped remove the clot also increased bleeding, and so you exchange the thrombosis for bleeding, and so this then makes it now possible to eliminate the clot and not have the bleeding side effect, which is wonderful. Dr. Perez?
What's also very, very important that you stated was diagnosis of making the diagnosis and not missing it. And like this, like we're talking about now, it's education to being able to know what's going on, to be sensitized. I have a girlfriend who saved her husband's life because of her recognition that he was having a stroke.
Mm.
Thank you for sharing.
Misinformation in this arena can be devastating.
Right, education is so powerful, and one of the things that we've learned from our MOTAP effort is that the source of fast change is the community. Educating the community and empowering the community to make a difference is as powerful as you can imagine, more powerful than you can imagine. And so getting this information out to the community becomes critical. And so the more programs we have like this that actually educate and empower the community, the better off we are. One of the things that we don't talk too much about is actually Darryl's program, his Black Health program that he does. He doesn't talk much about it at all, but it's an important way of educating the community. And we need more programs like these across the United States. Okay, let's go to the next article then. And this is an article that's kind of scary in the sense that it talks about heart disease and stroke increasing in women in the next 25 years. And our predilection to obesity, diabetes, and high blood pressure in women uh, are frightening because we know now that women have the disease as much as men, but it's not diagnosed as appropriately or as often. Uh, and so an ounce of prevention is worth a pound of cure in women just as it is in men. Any any thoughts or comments about this article that talks about women's health? And Dr. Perez?
It speaks to the important diversity, equity, and inclusion. This
Oh,
article was
the
made
antithesis of what Kennedy is all about, huh?
it's made possible by women in medicine.
Mm.
Okay, any other comments? Darryl?
Yeah, approximately 56 to 60% of black women in the United States are obese, and approximately 80% of black women are either overweight or obese. Black women are roughly 70% more likely to be obese than non-Hispanic white women. So that's the elephant in the room. Uh, we're bigger now as that group uh, than it was when I was growing up. And a lot of this is linked to disparities in access to affordable, healthy food and safe spaces for physical activity. But, that's very definitely linked to the rate of cardiovascular accidents.
Thank you for sharing. It's not something that can be overstated. Any other comments about this article and its impact upon women's health, especially since most of it is thought to be preventable.
This is Catherine, and I didn't say hello, everyone. The only thing I thought about this is the other thing Darryl was saying, lack of economics and whatnot. I'm saying we have money now. We don't have discrimination in restaurants now. So it may have some impact on the foods we're eating because we used to eat at home and now we eat out or we eat quickly. So economics can, having money can also contribute, as well as the fact that we now are in an integrated society, that we don't have any of those barriers anymore.
Thank you for sharing. Any other comments? Dr. Perez? Dr. Perez? Okay. All right.
There are many political issues that stand in the way, um, besides the end of segregation, that put many of our communities at risk. And I think, such as in Bethesda, for example, to get to a Kentucky Fried Chicken, you have to go 5 miles. Whereas in Crown Heights in Brooklyn, New York, I can find 5 Kentucky Fried Chickens within a 5-block radius.
Wow.
um, go into a bodega or a grocery store and find fresh fruits and vegetables. I mean, we have to look at it in a completely different manner. Where can you go? I know I'm right now in Los Angeles, right? And every park, I took the dog to the park, and there's places to exercise, where there are benches. I mean, if we don't see, and that's why diversity, equity, and inclusion is so important, because it's not only just a black-white issue. It's become an economic issue. Where you live, what your zip code is, makes
Well,
a tremendous big difference. And we have to talk it up.
well, the problem is that you keep saying that diversity, equity, and inclusion is important, but our administration is saying just the opposite. They're saying we want to eradicate it. So how do we juxtaposition those two divergent views?
Vote! Vote!
Well, you did vote. That's why Trump is in power. You voted.
Hey, I didn't vote for him. I mean, but we have to vote. We need to educate. We need to educate people to the fact that their vote impacts the longevity of their life. Be able to point out these issues. I mean, we just came out of Black History Month, the hundredth, the centennial of Black History Month. We have a president that wants to erase American history. Are you kidding me?
Okay. Shirley Johnson, any comment?
And good morning. Yes, I was going to say we talk about even the food. Have you ever looked at the grocery shopping of some of our younger people? Because everything is convenient, the TV dinners and everything else. And so, I mean, taking the time, like my mom, she took the time to fix a dinner or a breakfast for us. Now we got the boxes of cereal, we got everything that our kids need right there, the Pop Tarts and whatever. And
Uh,
so, what is this doing to us right now? These, the chemicals that they put in all of this food. Just look at the basket, us who are there. Okay, I'm not going to get this. And especially if they might have some food stamps, it's convenience, or they don't have to because I got to take my kid to soccer practice. I got to do this. And so now you just give them all the junk, or stuff that's not really healthy. And it's going to have a long-term effect, even though now you're just making sure that you're taking care of their hunger needs and stuff like that. So I think that could have some effect on all of this as well.
Thank you for sharing, Shirley. Carol?
There's one thing that we're all falling into. We're pointing fingers at everybody else instead of ourselves. So if each one of us, instead of asking why the community, we'll start with ourselves, then we go to our immediate family and go to family members. We all know we got family members that are on the opposite track, but you don't badger them with what is right. You show them which is right, and it goes so much clearer. I understand that because when my grandchildren come over, I tend to say, what do you eat at home? And I'll get that rather than do the work and cook them a nutritious breakfast so they'll at least have one. And then you start with yourself. Do I have the junk food around? Do I go to fast foods? Yes, I do. So I can't tell others not to go to fast foods if I go. So if I start cooking at home and cooking nutritious, so at least they know when they go to grandmother's house, they'll have something homemade. So if we start with, and like Kathy, my good friend, that generation, they're being controlled by the media. But like what Darryl said once, who's ever the loudest voice that is in their ear and they have enough respect, then they're going to say, well, my mother or my grandmother did it this way, and they seem to be having a pretty good life, or I enjoy that more than I do the fast foods. But if the fast foods taste better than your grandmother's cooking, you've lost the case. So if we even have people in our generation that said they were scared of the shots and they had this false about not taking the shots. And you say, well, I took it. And yes, there are some signs, but yes, we got to start with ourselves, and hopefully that will extend to the next generation. Like sometimes we would say, take these kids and beat them and something like that. Not unless you raise children the whole 24/7 can you control anything. And as I told somebody else, the only one we can control are ourselves. If we're obese, we can't tell somebody else not to be obese and do exercise unless we do it ourselves. And that's the end of my little sermon. Thank you.
Thank you for sharing, Carol. Darryl?
Yeah, the healthiest and most healthy weight Americans are Asian Americans. And what they typically tend to do at mealtime, they have the whole family there. They're eating a lot of family style meals where they have a big pot of rice. They stir fry it, use a wok. They have a lot of vegetables in the rice. And so that's their primary consumption rather than having a meat entree. And they maintain their weights very well, and they outlive us in the United States. And so they're getting the influence of Western diet, but they're not as influenced by it because they eat family style meals. They eat as a family rather than, that's the total opposite of the fast food environment. So we could take a tip from that because they got that together pretty well.
Thank you for sharing. Any other comments before we go to the next article? Okay. This is again a change in having a factor inhibitors with no increased bleeding risk, which is something that we're now having more of. which means that if we make an early diagnosis of stroke and we're able to eliminate the clot, the likelihood of having increased bleeding risk is less. So this then means that if you have evidence of a stroke or transient ischemic attack or any sign of that you are having a stroke, that you need to go to the hospital as soon as possible. And the earlier you get there, the fewer brain cells you lose. And so if you have any changes in your face or your muscles or your vision or anything like that, then getting to the hospital becomes even more important than it used to be because we now have ways of, of, of stopping the stroke, and we also have other ways of getting the uh, paralyzed extremity to come back to life again, so that we're having a number of changes in our stroke treatment that makes it more susceptible to recovery. And that's really the bottom line about these presentations, articles that we're showing you, that now if you have a stroke, getting an early diagnosis and proper treatment can eliminate you having paralysis. The longer you wait, the more likely you are to be paralyzed. The quicker you make the diagnosis and have the treatment, the fewer signs and symptoms you will have later on. Any comments about this article? That will go to the next one. We talk a lot about hypertension and stroke because we're in an age group where those are the common complications that we encounter. So that's why we do that. And the more that the earlier we get, the more likely we are to therefore reverse the impact of the stroke. And you see so many people who get a late diagnosis of stroke and they become paralyzed and become immobilized. And the earlier you make the diagnosis and the sooner you implement treatment, the less likely you are to have long-lasting side effects from the stroke. I think somebody had mentioned earlier that one of their relatives made a early diagnosis of stroke and saved the husband's life. So it's the kind of thing that we want to encourage. Let's go to the next article then.
This is the next article, Doc. Unless you want to skip
But
this.
this is another article that addresses improving stroke outcomes, and this is a intravenous loperamide, which is a neuroprotective drug that one of the problems after you have a stroke is that you have reperfusion, and reperfusion injury means that you have more toxic substances that are produced, which intensify the problem. And so this element that you have here tries to reduce the reperfusion and toxic elements that are associated with restoring blood flow after you've had a clot. And this new drug is better able to do that than the previous ones. One of the things that this article also talks about is the association of depression with strokes. When you have a stroke, the amount of anxiety and depression that occurs as a consequence impacts the result of the stroke. And it is thought that this new drug is influential in this fact. Dr. Perez?
One of the things that ABC, the Association of Black Cardiologists, had was the fact that grandparents, the importance of grandparents. And as we talk about strokes, at the time, it said that less than 50% of Black high school seniors had two living grandparents. And I know I had one, and my grandfather thought that I was the sun, the moon, and all the stars. Now, if I had four living grandparents when I was a high school senior, can you imagine how awesome I'd be? Because as I am a new grandmother, I encourage this young man. I pray for this young man. I mean, we are so important to our grandchildren, and we got to be around for them. And so I think, I'm just saying that because we've had these articles about stroke, and I know two of my grandparents weren't around when I was born because they had strokes.
Well, and the other, yeah, Carol, you had a comment?
Like to thank Dr. Perez for that. Gives me remembrance. Even in our generation, I hear people talk about what their grandparents did, what their mothers or fathers said, and they immortalize them, especially since if they have deceased. We're at that age that we don't know it, but we're the generation below us are always, they hinge on sometimes the words that we say, and they think it's so much wisdom. Sometimes I marvel how people remember what their grandparents said and mother said, and I said, now I'm at that age group. So whatever I say and whatever I do, generation's going to talk about, this is how they used to do it. This is what she said. And look how people, especially in our generations, we marvel at what our grandparents did. And they were nothing, they were human just like me. Of course, they were human, but I never thought that what I would say that would be carried down from generation to generation. But it is true. If you think about it, most of us, we think about what our grandparents did and what our parents did, and we somehow think that was the correct way to do things.
Mm-hmm.
Mm-hmm. You muted, Dr. Callender.
Dr. Callender, you muted, and Betty's hand is up.
Okay, Betty Blaylock?
Yes. I'm one of the, I guess I would say, unfortunate grandparents that ended up having to raise my grandchildren. And my one of the grandchildren that I raised often comments that he knows so much stuff that other people his age does not know, because he's repeating things he's heard me say or watch me do. And so I guess our influence on our grandchildren is a good thing, because even down to simple things. I know he said one day he was in the grocery store, and you know how they play music in the grocery store, and it's usually older music. And he started singing, and someone turned to him and said, "How do you know that song?" And he just politely said, "Oh, I was raised by my grandmother, by my grandparents." So um, it rubs off on them. But I was mama, but he knows that, I'm his grandparent, so he got so much from being around us old folk.
Right. Thank you for sharing. This article talks about the new technology that allows people who had been paralyzed to now actually regain some of the use of their limbs that they didn't have before. And these new technologies, uh, including electrical stimulation and other things, uh, threatened to allow some of the people who had paralysis to be able to use their extremities once again. And so there's a number of technological developments that have involved the brain implants and other things that allow people to once again use extremities that had been paralyzed. So, so those are some of the new uh, technological things that have occurred in stroke that they're talking about as the new innovations in post-stroke treatment, improving hand grip. Uh, because in the old days, you'd see more patients who had paralysis of the upper and lower extremities. And once they had that, there was no recovery. But now, uh, with the uh, technological improvements, some of these people are able to use their formerly paralyzed extremities. And that's what this article actually is talking about. And they also talk about implants into the brain, which help the brain waves to get the extremity to be used again. Something that was unimaginable decades earlier. So we're in a new era in many ways, and but to me, the real emphasis should be on making an earlier diagnosis of this stroke, treating it, and trying to minimize, if not eliminate, paralysis. So it is really a new frontier in stroke management. Now, what this article talks about the dementia risk to people who've had strokes and how they have quantified the likelihood. And you see, they studied nearly 45,000 adults with and without dementia and looked at what were the likeliest associates with dementia risk after the stroke. We were able to find some ideas as to who would get the dementia and who wouldn't. And although we recognize that for the most part we have not found a way to treat dementia, this is something down the road that may allow us to identify those people who are prone to have dementia and hopefully uh, have new medications that will allow it to be treated. We still don't have a good treatment for Alzheimer's or Lewy body dementia, the two commonest causes of dementia. But it is the expectation that with these tools, we'll be able to predict those who are likely to develop it and thereby try to get medications to try to delay the progression or eliminate the progression of the dementia. So that's down the road piece, but it's something in the foreseeable future. This is an article that is kind of surprising in that we're talking about wearable things that help you diagnose atrial fibrillation and other arrhythmias. And now we are talking about the ability to predict depression relapse long before the symptoms return. And this is a tool that is a relatively new tool that allowed them to predict the relapse of depression, which is fascinating because perhaps once you do this, you can intensify the medication uh, uh, or the therapy that you're going to use. Sometimes, as we know, medication is used to treat depression, and sometimes other means of treating depression with psychotherapy as well as medication. So, and if this prediction occurs, and then maybe those efforts can be used to prevent the depression, which is anxiety and depression, which are the commonest manifestation of mental illness. Well, as I know, this is the first test that has predicted depression before any of the symptoms occurred. So we'll wait and see how this wearable sleep device metric will be helpful. Okay, if there's no comments about this, we'll move on to the next article. Fibromyalgia is one of the most complicated diseases to treat, and it's not associated with high incidence of recovery. And one of the things that this article is indicating is that the depression that goes along with fibromyalgia may be one of the ways to allow for recovery from fibromyalgia. I know in the past, this was thought to be one of the most difficult diseases to treat, and the likelihood of getting responses was very low. This article is suggesting that if you can treat the depression, that you have a much better chance of getting successful treatment of fibromyalgia. And so this is an interesting development, and time will tell if this really results in successful management of fibromyalgia. John Buchanan?
Yes, can you tell us a little bit more about what that is, what fibromyalgia is? It looks like it's painful.
It's a condition in which people have a lot of pain all over the body, and it's associated with inability for the pain to respond to traditional medications that are used. And I think of all of the conditions that I've had to treat, I don't know any that was more difficult to successfully manage than fibromyalgia. Darryl, did you have a comment to make about it?
Yeah, it's most likely to affect women who make up 80 to 90% of the cases, and women between the ages of 30 and 50 years old, although it can affect any age or gender. And genetics play a role. if you have a first degree relative with a fibromyalgia, that increases your risk. If you have autoimmune or inflammatory diseases like lupus, osteoarthritis, you have higher risk of having fibromyalgia. So, from a diet standpoint and prevention, if you're on a diet that does not include inflammatory foods, that can reduce the incidence or severity of fibromyalgia. The most prevalent the primary inflammatory foods in a diet are going to be red meat, processed foods, sugar, alcohol.
In many instances, fibromyalgia was a wastebasket diagnosis that was made when you had people who had pain and inability to move their extremities, and you couldn't find any other reason. In many instances, those were the people who were diagnosed with fibromyalgia. Thank you for sharing, Darryl. Any other comments? This is an interesting article that says that because panic disorder is an entity that exists, and we've had a number of our patients who actually had panic disorder, and we talked about it many instances, and there wasn't a whole lot of exercises that lessened panic disorders, although there was medication that was used. But this article suggests that 12 weeks of a sprint exercise program was effective at decreasing the number of panic attacks that people had. And panic attacks were very destructive, and people, we had some transplant patients who talked about the fact that they felt like they were going to die, and they just there's nothing they could do to relieve the panic that they felt. And there was some medications that sometimes was effective, but this article is suggesting that these intensive exercises play a role in decreasing the frequency of the panic attacks. I don't know if anybody on the panel has had a panic attack. I know we had some transplant patients who actually told us about the panic attacks and how difficult it was to experience it and to overcome it. Not very common, but when it occurs, there's a sense of doom that affects them.
Doc, is there another name for a panic attack?
No, it's just called a panic attack. Anybody on this panel had a panic attack? Catherine?
I've never
No.
had them, but my son had them when he was probably maybe 13, 14. And then I think he's had them again as a young adult a few times. I really wasn't prepared for that at all, especially when he was younger. And he had them when I was on a highway driving somewhere. So
Wow.
I had to pull over and like the window down or let him out on the side of the road so he could breathe and give him a paper bag to breathe into because he was hyperventilating. It was scary. Scary, especially
Thank you
for
for
a young
sharing.
person. Yeah.
Well, let's see. Yeah. Okay. Dr. Press?
I've had quite a few children who've had adolescents who've had panic attacks. And again, in terms of misdiagnosing and having environments that are receptive and not punitive for it is crucial. And it became very important for me to interact with the education system. The ones that come up in my mind, in my memory the most, were those who had asthma. And it precipitated an attack, which then, as you know, can be life threatening. Um, so it being knowledgeable about it, what to expect, and how to appropriately diagnose it, and provide a supportive environment is key.
Carol, you had a comment?
Probably I missed it. What brings on a panic attack?
Who knows? I wish you knew, because they aren't always predictable. They just happen.
After you have one, do you know why you had one? Nobody knows why you
No,
have a panic attack.
no. Most of the people who've had panic attacks had no idea why they had them. Dr. Perez, you have any other information to the contrary?
No, but I've always wondered what the connection was with post traumatic stress disorder because they're very similar. So I
Okay.
think maybe with additional research in that arena, we could find like allergy or something like that, that there is something that precipitates it. But to the best of my knowledge, no, I don't know.
Yeah. Yeah, we had one of our transplant patients to talk to. She's not on this group right now, but she talked to us about her panic attacks, and uh, there were no actually predictable things that brought it on. They just can't happen, and when they happened, they just took over everything. Darryl?
Yeah, just reading on some of the symptoms of a panic attack where your heart races, you could feel chest pain, uh, breathing becomes difficult. I could see, okay, like I used to have a AFib condition that's been resolved, but AFib, your heart races. I didn't allow that to scare me to death. I got to the emergency room, which is a good thing. But I can easily see um, if you do panic, how you can make the situation worse, because the panic comes from what's going on. Am I going to die? You get scared to death.
Right. Yeah. Yeah. Right. That's what drives it because most of the people feel that they're going to die. Right. Yeah. Okay. I guess this is the last article. So, any closing comments? We had a lot of comments. We lost one of our MOTAP people. Norman Brooks died uh, this week, and so he's been with us with MOTAP for at least 20 years, and so we mourn his passing. And when we learn of arrangements for his uh, funeral arrangements, I'll let you all know. Yeah. Any Yeah.
We
Carol?
did have one new person, and he did say he had to drop off. So the people that came on late, what was his name?
Richard.
Richard.
Yeah.
Richard.
Yes.
And,
John?
Yeah,
It was John.
he'll be back. He'll be back next week, I believe.
Yeah. So, well, thank you all for attending. It was a great session, and God willing, see you next week.
Thank you, Dr. Callender.
Thank you.
Thank you.
Thank
Be safe,
you.
everyone.
Thank you, everybody. God bless.
So, Carol, did